This is Dr. Corey Maas on Looking Your Best, talking about one of my favorite topics, which is lip enhancement and augmentation. And I could consider this part two of what we've talked about in terms of lip beauty, the surgical options that are available, because there are a number of excellent surgeries that are minimally invasive and give long-lasting results for lip enhancement and augmentation. It's an area of obviously natural beauty for the face, lips, along with the smile and eyes really enhance beauty both in men and women. It's not limited to just women, although we certainly think of women's lips as being one of those things of great beauty. In general, just a quick review, the lip should be diamond shaped, meaning higher in the middle, like a diamond turned on its side. As we age, it has a tendency to elongate and become more rectangular and flatter. So what we're trying to achieve is more of a diamond shape and more typically volume if we've lost volume, with a natural lip roll at what we call the white lip border, and really augmentation of the lower lip in the central 2/3 area to help that lip naturally with gravity turn outward. Now, many patients are born with a very thin lip, and we often look at this as being inverted lips. And I can show patients by doing a gentle lifting just below the nose of what they can actually see if we evert or turn outward that vermilion border. It's a good exercise if you have thin lips for you to do, just to slightly let those lips turn outward. And that's what's achieved what we call in a procedure that we call a subnasal lip lift. And I say a subnasal lip lift only because that's my preferred method to evert and create a diamond-shaped lift. There's also a diamond-shaped lip. There's also a direct, what's called a direct lip advancement procedure or vermilion advancement procedure, where an incision is made right along the vermilion border and a small segment of skin is excised above, and we can decide how much that would be. And then the lip is advanced up to that, and right along that border there's a very careful suturing that's done to achieve more red lip to white lip ratio. In other words, create more height to the vermilion. We talked about this before, but there's always a limit when you're doing cosmetic fillers on the benefit of how much vermilion can be seen, which is where the lip lift that we get with the cosmetic filler is exceeded in terms of natural beauty by the projection, or how far the lip sticks out, the so-called fish or duck lip. And I see so many of these patients that I feel that come to me, and what we really want to do typically is either limit the amount of volume we're using with the filler or offer the surgical option, because the surgical option is a good one. And the subnasal lip lift offers the benefits of maintaining that natural white lip roll, the border between the white and red lip, while still creating more vermilion show and more of that diamond shape that we're seeking when we look for the optimal lip. With the direct lip advancement, the downside is there's some flattening of the lip border, just the natural way a suture is done. Now we can overcome that with fillers, but in my opinion, the first step for doing a lip lift is a subnasal lip lift. I can hide that incision very effectively in and around the nostrils, creating a nice contour to the upper lip. And in the lower lip, we're just relying on volume because gravity is helping us. The other parts around the lip I think that are very important are we can advance the vermilion directly with incisions inside the lip in what we call a VOI advancement. So there's two V-shaped incisions made on the inside part of the upper lip on each side, and I close that like a Y, which naturally rolls that lip out and creates eversion, where the lip is seen more clearly. And often I'll do the two of those procedures together. The V to Y advancement can also be done on the lower lip, and so we can do upper and lower vermilion advancement by doing a V to Y without having any incisions that are visible, all on the inside of the mouth. Very easy to heal. The procedure is done with local anesthesia, or if you want to have sedation, it's fine. But they're in and out types of procedures with minimal swelling and sutures that dissolve by themselves. And the last but very important surgical augmentation that I'll talk about, or enhancement of the lip, is what I describe as the corner of the mouth lift. I've written papers again about this, but the purpose of this is to take that downturned mouth, often called a downturned smile or an apostrophe lip, and turn it to where it's at least parallel. That's really what we want. We don't want to turn it way up and make it, as a lot of people describe, the Joker lip, but we want it nice and parallel because the corners of our mouth do turn down with age. And there are options like treating the DAO muscle, the depressor anguli oris, which relaxes one of the things that pulls down the corner. But that has very strict limitations to it, and those are gravitational primarily and age associated. But the corner of the mouth lip lift is what you're trading off is this commissure bump and really a depression at the corner of the lip for a nice flat lip that is even and parallel. Taking it from a dour, sort of sad or unhappy face, if you were thinking of stick figures, to a nice neutral or slightly smiling face. So with these new tools that we have, the plethora of cosmetic injectable fillers, we can offer everyone some benefit in enhancement of the lips with lip volume. Unfortunately, for all of us, the tools that we have benefit most the patients that already have really nice lips. In other words, they can get more volume and still look natural. The thinner the lip in general, the more limited we are, because we never want to exceed the benefit in vertical height that we get with a cosmetic filler by over projecting the lip, giving a so-called duck or fish lip look. And that's where the surgical options step in. Natural, well-hidden incisions, creating a lot of vermilion show, that's the red lip, and shortening of the white lip, so the white lip, red lip ratio is ideal. It's really what we'd like it to have. We can control that. If you have any questions about surgical or non-surgical lip enhancement options, I'm happy to talk about them. You can write me at drmaas.com, send pictures or video if you want, and I can comment about them privately or publicly, or just come in for a consultation. We'd be happy to see you. As always, it's my pleasure. This is Dr. Corey Maas on Looking Your Best.